more, but Aisha Verrill is the new addition to the team, and as a new MP also straight into Cabinet. There's no question that in health there remain some very serious challenges, not the least of which is ongoing response for COVID-19 that needs a dedicated response, and not just what happens in the health sector, but what happens in other government agencies as well. And that's why it's great that Chris Hipkins is able to continue his work, and in fact, in that respect, to add to it, to pick up the work that, for example, Megan Woods was doing on the managed isolation and quarantine facilities. But actually, for the rest of health, there are major challenges as well. We've got the Simpson report that lays out really what is needed to transform our health services. We've already had the mental health and addiction review. We've started the implementation of that, but that needs to be driven and pushed as well. So I feel hugely privileged to have been given the role as Minister of Health. I feel honoured to have the assistance and support of people like Penny Henardi, Peter Williams-Seow, and now Aisha Verrill, who will bring her incredible depth of knowledge and understanding to the public health requirements that we know are all still needed. This is the team, and now happy to answer your questions.
Do you feel suitably qualified to be the Minister?
I think what's needed now for a reform program is somebody who can drive officials and drive the machine to make the change, and so I feel suitably qualified to do that.
How are you feeling about the challenge?
Look, I think it's daunting. I spent the weekend getting my head back around the Simpson review. I'll reread the mental health and addiction report. I've got a bunch of other reading I've got to do as well. I think the next couple of weeks is going to be reading. But that's the way I approach it, and I'll spend the weeks after that getting around the sector, meeting people, getting to understand it and understand the breadth of it. But I feel confident about rising to the challenge. I relish the challenge.
Did you request the health portfolio?
Look, there's a range of discussions that you end up having. I was gratified to have it. I was honoured to be given the challenge to have it.
What is your number one priority now?
I think now, with the benefit of the Simpson report and understanding that the release of that report and the completion of it has been pushed out, we've seen through our COVID-19 response where there are many gaps in our health services provision. If we're thinking long term, we really have to drive change in the system. We have to drive it because we know, for example, some populations are not getting the level of treatment and service they need. We see that specifically with Māori and with Pacifica, which is the role that Penny and Opito will have a huge leadership role to play in. We know that in rural areas they struggle to get access to health services in the way that they should. So I think taking hold of the Simpson report and now really starting to drive that change is going to be vital.
How soon are we going to see fewer DHBs?
Look, we'll work our way through the report. That's one of the recommendations, reducing them from 20 to 8 to 12. We've got to work out what that is. I think the most important thing is to make sure the structure that we've got is delivering the frontline services that are needed. We know that primary health care is the most effective form of health care, and we want to prioritise that.
Chris Hipkins, how do you feel about your new role, and are you pleased to, be able to oversee the COVID-19 response in the next year?
Look, COVID-19 is a huge challenge. It's going to be a challenge that will be with us for some time yet. Obviously, I've spent a bit of time over the last 4.5 months looking at all of the ins and outs of our COVID-19 response, identifying where we needed to strengthen things and taking action to make sure they are being strengthened. That's an ongoing process, though. It's something that we're going to have to keep doing, and I'm very comfortable with continuing to lead that work. Look, obviously we've got a big challenge coming up around managed isolation. There's a lot of pressure on our booking system. We've got a lot of Kiwis coming home for Christmas, so we're going to have to work very carefully to make sure that we manage our capacity there very carefully. We've still got to keep our testing surveillance rates up. Our testing rates have stayed relatively high over the last couple of weeks. I'm very heartened by that. They drop off a bit in the weekends, but they've been coming back to a good level during the week. So we need to keep our testing rates up. And we just need to constantly keep looking at where there might be gaps or where there might be risks that we haven't fully mitigated, and doing everything we can to plug those gaps. Sorry, what was that? Look, we've got a very sound system for managed isolation. I'll always, again, be looking closely at how we might be able to improve that. We have got a new allocation system, or a booking system, if you like, which becomes mandatory tomorrow. And so people coming back into the country will have to have a confirmed place in managed isolation. That's going to make it a lot easier for us to forecast demand and make sure that we're matching supply and demand more carefully. So making sure we're bedding that in, making sure that we get that system operating effectively is obviously a key priority for us. I'll let you finish that. And then.
So large, how come you can do this and keep education, for instance?
Look, I said to the Prime Minister I thought that it would be challenging to do both health and education. When she asked me to do the role about 4.5 months ago, I also said at the time, and I think I said publicly at the time, I think it would be unreasonable to expect someone to continue to do both roles in the longer term. But I do believe that the COVID-19 component is something which we've got a bit of momentum behind. I think I can manage to do that. I've managed to do both jobs in their entirety over the last couple of months. And I think this will be a slightly lower workload than the workload I've had for the last few months. So I'll let Audrey.
If there's a monumental failure, say, by a health official in the testing area, which minister will be responsible?
Look, we'll be working very closely together. One of the things that we have to do in the next few days and over the next week or two is sit down and work out how we best coordinate our public sector to line up behind our COVID-19 response, because whomever the minister is and whichever minister is responsible, there is always going to be a number of different departments and agencies that need to be involved in that, and my job really will be to make sure that they're joining up and working together in the way that we need them to be.
And as you know, Audrey, the minute something goes wrong, the first thing a minister does is reach to see if they can take responsibility for it.
No, not at all, and it hasn't done over the last 4.5 months that I've been doing both roles. I've still managed to keep the wheels moving in education. We've got a big reform program happening in education, one that's also critical to our COVID-19 response. So if you look at the work we're doing around skills, for example, we know that we need to retrain and reskill a lot of people for the jobs that are going to be available in the post-COVID-19 economy, and we've got some real momentum behind that work as well. So I think I managed to do both, and I'll obviously be continuing to be very vigilant about that.
Did you ask to continue overseeing?
Michael Baker and Nicholas and a few other epidemiologists have repeatedly called for a government review of the entire sort of COVID-19 response thus far to identify those weaknesses like you're suggesting. Is that something that you want to see?
Look, I've always said that I think we'll get to that point eventually where we end up with something quite formal, whether it's a Royal Commission or some other kind of inquiry into the overall response. That's happened after big events, like earthquakes and Pike River. There was one after Pike River and so on. So, of course, we will get to that point. But our focus at this point has to be on continual improvement, so reviewing and improving as we go. So it's wrong to suggest that we aren't reviewing as we go. We are looking all of the time at how we can improve. So if you look, my new colleague here did a review of our contact tracing system, and we made improvements based on that. We've had a review of our testing regime, which has been done by Brian Roche and Heather Simpson, and we're making improvements based on that. So we are always reviewing and improving as we go, and we will get to the point where a more formal for the record review is done, but for now we can't afford to slow down and distract people from the very critical task that's in front of them.
Shavira, this is a big step up for you. How do you feel politically getting into this role?
I feel very humbled to be appointed as a first-term MP straight into Cabinet, and you would have heard the Prime Minister's comments that the pandemic is a key consideration in the appointments she's made, and I'm eager to bring my expertise in that area to the Government's response and sustaining what's been an incredibly successful response. I'm excited to be working with such experienced ministers in the health team.
Is there room for improvement?
There's always room for improvement, and I'll bring a critical eye to the briefings I get in the next few weeks.
How does your role fit into the sort of how you and Minister Hipkins would coordinate that COVID-19 response?
So my delegation is in public health, and that's where my focus will be.
Did you expect to find yourself both a brand new MP and brand new minister?
I tried to expect nothing but be prepared for anything.
There's a lot to learn in your first term. Can you both learn how this place works and be a minister?
I have to take it one step at a time, and I'm pleased to be incredibly well supported by the party.
Do you anticipate a steep learning curve?
Of course.
What do you say to people who might be concerned that you haven't had that experience and you've gone straight into Cabinet?
I think I'm going to approach this with the same diligence that I approached my career in medicine, with a focus on the people that I'm responsible to, and that's the New Zealand public.
What were your priorities in public health?
We made a commitment to be smoke-free by 2025, and obviously that's a really ambitious target, but we could save 5,000 early deaths per year in New Zealand if we do that, so that'll be my focus.
There's long been a sort of advocacy for some sort of centralised public health body. That wasn't in the Heather Simpson report. Is that something that you want to look at?
We had a manifesto commitment to implement a public health agency, so that will be one of the pieces of work we take forward.
All right, thank you.
Thanks, everyone.
Before you go, can you give us a team shot together? Sure.
What was that?
Or Peter? Just a quick photo here.